Good day, everyone. We are the Pentamigos, and we are here with the team walking towards progressive innovation, improving life through transformative health inceptions.
As face masks become the day-to-day norm around the world, it's become harder to understand people's muffled words as well as reading and expressions. Even thin masks can be uncomfortable to wear, especially after many hours, but the biggest challenge lately has been finding a way to make them less impersonal. For instance, caregivers trying to comfort patients or to show compassion through their mask have been struggling to do so in the past few months. For the goal of transparent face mask, researchers from Switzerland have collaborated to produce a fully transparent surgical mask that will prepare the three-layer mask that medical personnel currently use. The mask was created primarily to improve nonverbal communication between nursing staff and patient, but it might also be used by the dentist to prevent the spread of infection and viruses like SARS-CoV-2. Early in 2021, the product is planned to be released.
Technical details of the work. The material is made of a membrane made from a polymer that is 99% from a biomass derivative. The process of making this is called electrospinning, where an electric force is used to draw polymer fiber, and the architecture of the fibers creates extremely small gaps.
Next is the outcomes of the work. From the data gathered, it is proven that the transparent masks are biodegradable and recyclable. Moreover, because of the structure of the material, air can pass through while viruses and bacteria are blocked out. The researchers are now trying to make the product 100% eco-friendly.
Now, let's talk about the social impact of transparent face masks. The first impact is an environmental perspective. It would reduce the waste produced by the traditional face mask since the transparent face mask is now biodegradable. Next impact on social perspective. Communication will become easier since we can now see better the facial expressions to whom we are talking to. And lastly, for psychological perspective, nurses are now able to sympathize with patients, to show their smiles, and to boost their morale.
The next product that we will be talking about is iWalk. Lance, a fifth-generation farmer, after sustaining a broken foot, he was relegated to crutches and unable to go about his day-to-day activities. He found crutches tremendously impractical and uncomfortable. He would use a stool to rest his legs on, which led him to be inspired to create a new kind of crutch. Lance developed a revolutionary crutch that would meet the mobility needs of people with lower leg injuries, yet keep their hands free, which would be called iWalk.
Technical details of the work. Ewok is a hand-free crutch made of extruded aluminum and engineered plastic which involved resting your leg in the crutch to work similarly as a prosthetic leg. It was approved as a Class 1 medical device in Canada in 1999. Shortly followed by PTA registration and CE marking, the Ewok has been the subject of the numerous clinical and university studies like comparing it to the arm crutch through clinical evaluations.
Today, thousands of enthusiastic users have proven that there is a better way. Once again, from a simple idea and unwillingness to accept the status quo, an industry was changed forever. The outcomes of the work. As per the results of studies, the iWalk is preferred by 86% of foot and ankle patients over crutches. Moreover, a randomized control trial with 80 patients with both upper and lower limb injuries showed that they were able to complete activities around the house using the iWalk, and patients had a more positive attitude to life due to the improved independence with the iWalk. and after a few modifications, they now have iWalk 3.0.
Societal impact. From a technological perspective, this would help patients increase their mobility without feeling any discomfort. From a medical perspective, patients would not feel any muscle strain or fatigue from prolonged use of arm crutches. And from psychological perspective, people's emotions would be elevated because they would be able to do things like they didn't even had a leg injury.